I love GLP-1s. You will not hear me say a bad thing about GLP-1s, but what I will say is that they need to be used correctly.
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk. We feature the top medical practitioners in health and beauty, both inside and out. I have Lauren Hodge, who is the founder of Salah Aesthetics and Wellness in Columbus, Georgia. With over 8 years in the medical field, she is a board-certified family nurse practitioner and advanced aesthetic injector. Lauren is known for her signature approach to subtle, natural-looking enhancements and facial balancing. She combines her passion for holistic wellness, regenerative aesthetics, and medical weight management to empower her patients, helping them achieve confidence and radiant health from the inside out. So Lauren, welcome and glad to have you here.
Yeah, thank you so much for having me.
Yeah, so how did you get first interested in aesthetics?
So I kind of fell into it. When I was an RN, I worked in pediatrics, and then I went through my nurse practitioner program, and I was pretty certain I wanted to stay in pediatrics. But at the time, it was 2020. It was in the middle of COVID. Things were crazy. It was kind of difficult to find a nurse practitioner job at the time. So I ended up in chronic pain management. And there we started doing Botox for migraines. So that was when I originally got introduced to Botox, and I really enjoyed the hands-on procedures. And of course, my patients were asking, well, since you're already injecting for my migraines, can you add on my crow's feet and other areas? So I continued doing more courses and learning more about different tox injections and filler. I then took a job in orthopedics for a year because I knew I kind of wanted to move into aesthetics, but wasn't quite ready. And at the orthopedics position, I got a lot of experience with PRP and doing PRP for joint injections. And I was actually trained there to do spine injections like epidurals and facet blocks. And then after a year of being there, I finally decided that I had enough knowledge, I had enough training that I was ready to fully move into aesthetics. So I opened my own practice.
Wow, it's been quite a journey then.
It has, but definitely each position that I took led me to exactly where I am today.
Got it. Now, what are some of the common treatments that your patients come to you for?
First most popular would probably be medical weight loss and hormone replacement therapy. That's a lot of what we do. Second would be Botox or Tox. I find that that's kind of everyone's entry point into aesthetics or to injectables. That's usually where people start and then eventually branch into other areas. And then third would definitely be more regenerative injections, whether that be with Radiesse or the PRP or things like that.
Got it. Now, you talked about a couple different treatments. I want to unpack some of these ones by their, I guess I'll call it the overall category. And I want to touch on holistic wellness first. So you mentioned hormone replacement therapy, but how would you define holistic wellness? Like kind of what covers that and how is it different from aesthetics? Or I guess how does it tie into aesthetics?
Sure. So we're all about treating the person as a whole. So if you feel good, then you radiate that from the inside out. So a lot of patients come to us first with wanting, they don't feel good, whether that's they want to become healthier or something just doesn't feel right. And we do a hormone workup or things like that. And then once we get them on the right track, they start feeling better about themselves. And they really do radiate that, and it creates confidence before we even get to injectables.
Okay, so I guess it's more about fixing the root cause.
Yeah, absolutely.
Okay, I think that's also very important to understand, 'cause I think when people think about aesthetic medicine, they think of it more just from the outside and not from the inside out. So are you kind of seeing that this is more of a trend is going in that direction, even though it more in the aesthetics field, but people are still looking at that internal fix it from the inside out approach?
Patients are definitely leaning that way. A lot of patients feel like they go to different providers now and say, I'm feeling this way, or this is going on with me, and lab work is not being run, or issues are not being addressed, or, oh, we'll just prescribe this medication and you'll feel better. But here we really focus on, we run those lab tests. We see, are you deficient in a certain area? What can we add? And a lot of our skin concerns are addressed to our well-being on the inside and our gut health.
Got it. And you talk about gut health, which I think is, I mean, I believe the concept's been around for a while, but it's not really hit the mainstream. So could you talk a little bit about what is gut health if you had to explain it to a fifth grader?
Sure. So gut health is, we actually have lab tests that we can run and we can check bacteria levels and things in the gut. And unfortunately, for most of us, we have not paid attention to our gut health, whether that be just unhealthy diet and lifestyle and things like that. And it can actually create what kind of we refer to as like a leaky gut, and where there's holes in the membrane and bacteria and things can seep through that and penetrate into the rest of our body. And it can actually lead to imbalances in hormones and other areas of our body.
Got it. Okay, so that's the holistic side.
Mhm.
Next area that I want to go over was the regenerative medicine side that you talked about. So regenerative medicine, this falls into like exosomes, PRP, PRF, all those kinds of things. But for people who are not so familiar with regenerative medicine, how would you describe regenerative medicine and really the benefits of regenerative medicine?
Regenerative medicine is taking substances or products and whether injecting them, it causes restoring and stimulating your body's own collagen and elastin production using growth factors and things like that.
Okay. So is it kind of maybe tied to the holistic side where like you're kind of using your own body to regenerate itself, where it's a little bit more natural? Would you say that that's pretty accurate?
Yes, that is accurate. Most of our products that we have, like exosomes or PDGF, they were based on PRP. And for those that don't know, PRP is platelet-rich plasma. So that's your own plasma. Your own plasma has a lot of growth factors in it. So that was kind of where regenerative medicine started, was using the plasma and the growth factors in that and injecting it in, whether for joint injections to heal tendon repairs and things like that, hair restoration, facial injections, and then it's grown from there into products like exosomes and PDGF.
Okay. So when I heard about regenerative medicine previously, I heard of it more within the orthopedic space. So it's like more like back pain or neck pain or knee pain, like really helping to solve those issues. But over the years, I'm starting to see it become more and more prevalent on the aesthetic side. So do you think it's going to be like there's going to be more and more regenerative medicine products within the aesthetic side as well?
I definitely think so. Every few months, there are new regenerative products hitting the market for aesthetics. So I think it's going to continue to grow.
Got it. Okay. And then the last one that I wanted to go over was the weight loss, the GLP-1s, which really exploded in popularity over the last couple of years. Um, Now, I've heard a lot of different things about GLP-1s. There's the good and then there's the bad. Like the good thing is that you can lose a lot of weight very, very quickly. I've also heard long term, it's not necessarily the best solution, or that you lose a lot of muscle along with it. So if you're not working out, it can be detrimental to you. So what's your overall thoughts on GLP-1s? When should people use it? When should people not use it?
I love GLP-1s. You will not hear me say a bad thing about GLP-1s, but what I will say is that they need to be used correctly. I have a lot of patients where we can even it's called, or some people refer to it as microdosing GLP-1s, which means we're using lower than the recommended starting dose. But not only are patients losing a good bit of weight, but it's also decreasing inflammation in the body in general. So it's helping with joint pain. It's helping women regulate their hormones for PCOS. Women who suffered with fertility issues are actually having success now. And a recent study actually showed that the GLP-1s are slowing the progression of Alzheimer's. So a lot of amazing benefits to GLP-1s. The problem is that sometimes they're not used correctly. So all of my patients know that I start low and I titrate up that medication or increase the medication very slowly. If you're losing weight, if we're achieving the benefits, then why increase if we don't have to? All of my patients also get a monthly body scan, and our body scanner uses AI to scan the body, and it'll give you a 3D picture of your body. It'll tell you your muscle mass, your body fat percentage, and as well as all of your measurements. So we use that to make sure that we're not losing that muscle mass. Also, my patients know that I'm pretty hard on them about still eating. I enforce a healthy caloric deficit, and also I give each of my patients protein goals for the day, and I ensure that they're hitting those protein goals to lose weight, but in a healthy way.
Got it. And do you think that GLP-1s are something that can be used in a long-term sense, or is it more of like use this temporarily to kind of get you back on track, lose that weight, get to a certain spot, and then from there you transition into something else?
It depends on my patient. I do think they're safe for long-term use. There's actually some research being done currently that's finding that some people are deficient in GLP-1s in their body to begin with. So that is leading to the weight issues. So by adding that GLP-1 and replacing what they're deficient in, that's what's causing the weight loss. So I do think for those patients and those who really struggle, it is safe for long-term use. For some of my patients who just I have some that cycle, so they'll do a few months on and then they'll come off for a few months and then maybe cycle a couple more months. So really, I work with my patients one-on-one to figure out what their goals are and what the best route is going to be.
Got it. Okay. Well, thank you for explaining all that, Lauren. Now, I'm curious because since you offer a lot of different types of services, which I think is starting to get a little bit more and more within medical spas, but traditionally, like they don't have a lot of these other things as far as like the holistic health side, the regenerative medicine side, the weight loss side. So aside from that, what are some other ways that your practice is really different from others in the industry? Like what really differentiates you?
So the word Salah is a word used in the book of Psalms in the Bible, and it means a pause in the text. So I really wanted this to be a place where people could come and take a pause from their busy life and leave feeling better about themselves, leave feeling regenerated and restored. I think that burnout is so real for a lot of us now, whether that just be in our jobs, taking care of the home, raising kids. A lot of us have not prioritized ourselves. And so I wanted that to be the main focus here. So although we are, very medical based, I'm very much in the research and understanding all of that, I do try to provide a comforting atmosphere. I always ask my patients what kind of music you like to listen to. I have coffee, I have water. We have weighted blankets for those that like it. I do try to mix relaxing with the medical side to treat the person and their soul at the same time.
Nice. Very well said about that. Yeah, I think because a lot of people when they come into something like this, especially if they don't know really everything that goes into it, or if it's their first time, they may be a little bit nervous, a little bit jittery. So everything that you mentioned, I think, is a great way to help them feel more relaxed, feel really taken care of, so that this experience overall is going to be just great for them.
Yeah, absolutely. A lot of my patients have become more like friends when they come in. I prioritize taking my time with each person and finding out their goals and treating them accordingly. I never want anyone to feel like just a number when they walk through my door.
Got it. Now, as far as we're talking about kind of the educational part of it, how do you approach educating your patients on really all the treatments that you have, the benefits of it? Because you offer a lot of different things. So, how do you approach that education of what do they really need, what's going to really help them, and how are they made aware of everything that goes into this?
Sure. So first I ask what their goals are, whether that be for weight loss or hormone replacement, they want to feel better, or whether that be on the aesthetic side, they want to treat these wrinkles here. I find out what their goals are first, because I never want to point out something that they don't see. So I ask them their goals, and then from there, I can create a treatment plan and educate them on the different services. And I really am passionate about educating them on why those issues are happening, whether that be on the weight loss side of things or aesthetics. We're losing bone here, we're losing volume loss here. That's creating what you're seeing. So by doing X, Y, and Z services, it's treating that cause.
Got it. Okay. Now, I'm sure that when your patients come in, there's a lot of myths that they believe. They have a lot of common misconceptions about what you do. What are some of the most common misconceptions you hear from patients and potential patients?
The first would definitely be I'm going to look fake getting injections with tox or filler. And that's not true. I think it's kind of hard to look fake with tox. It can be done, but I think it's pretty hard. And filler usually, you know, unfortunately, we have seen those faces that are very overfilled, and that is what our fear stems from. But filler can actually be a very good tool, but I believe it is either one to be used to replace lost volume in the face or to create volume areas where we don't have a lot of volume genetically, like a recessed chin or things like that. So by using filler strategically and smaller amounts in the face, it creates a more harmonized and natural look.
Got it. Now, you did mention on something that people don't want to look like they are overdone. When I talk to a lot of practitioners all across the country, it seems like people are looking for more of that natural look. They're getting away from the overdone look. Is that something that you're also seeing within your practice? People looking for that more natural, like they don't really want to look like they've gotten work done on them?
Yes, absolutely. And that is where some of our more regenerative products come in, where not only are they giving a little bit of volume, but then they're also going to stimulate your own collagen and elastin over time. I offer PRP filler, which is essentially where I can draw a patient's plasma, draw their blood, spin it, separate the red blood cells from the plasma, heat and cool the plasma, and turn the plasma into a gel-like substance. And I can essentially inject that anywhere in the face, just like I would a traditional hyaluronic acid filler. So that's something that my patients enjoy because it's completely all natural. It's 100% your own body's production.
Got it. Okay. And so we talked about the tox and filler. What about other misconceptions that you or myths that you tend to hear quite often?
Misconception is one treatment is going to fix everything. And I get it. We all want instant gratification, but unfortunately, that's not always the case. Many of us have, like I said, neglected kind of self-care over the years. And so by coming in, it's really important for us to create those treatment plans and set realistic expectations that yes, one treatment can improve, but it's not going to give 100% the best result. And it really is going to take several treatments over some time to achieve best results.
Got it. Now, do you ever have people coming in with like Instagram photos and they're like, oh, I want to look just like this. And it's obviously like very heavily filtered and it's like, it's just not real. Do you get that?
I do get that, and what I tell my patients is we can try to get you the result that you're looking for, but ultimately I'm working with what God gave you and I'm working with what you were born with. So although sometimes I can try to tailor your anatomy to look like your goals, you were born with what you were born with, and sometimes that's what we're working with.
Got it. Okay. You have to just bring them down to reality.
Yeah.
Okay, got it. Now, Lauren, since you have a pretty wide background in medicine, I'm curious, what role do you believe artistry plays in your approach to patient care? Because when people think about medicine, I don't think artistry is the word that necessarily comes to mind, but within aesthetics, I feel like there's a lot more creativity that has to go into it. So, what role do you think artistry plays in what you do?
Creativity definitely does play a role in injections. Knowing how to place what product where and to create either what the patient wants or what is aesthetically pleasing to the eye. But more so than that, for myself, I think that I've always been a perfectionist, and I feel like that really plays a big role for me in this. I'm constantly, when I'm injecting, I like to take my time. I block out a lot of time for my injections, and I really analyze as I'm going exactly, where I need to put more volume and things like that to make sure that everything is as perfect as I can get it. And then really understanding the aging process as well and understanding why things are the way they are, whether that's a nasolabial fold or the marionette lines, why those are getting bigger because we're losing bone and losing fat pad in other areas. So that's really important to understand in injecting too, to know how to kind of treat the root cause of it to fix the issue.
Got it. Okay. Now, Lauren, I'm sure that throughout your career, you've had some particularly challenging cases that you've that have come across. So, is there one story in particular you can think of just someone that came in, tough case and really how you're able to get them a good result in the end?
Sure. One case does come to mind. I had a sweet patient. She previously had had a facelift, but the facelift was, she called it a failed facelift. It wasn't quite what she wanted and what her expectations were. And then one side of her face had more volume than the other side, so it was very disproportionate. So we've had to go in, and she had had injectables done over the years, other places, but still couldn't quite correct the issues that she was having. So she came to me, and we have done several treatments of Radiesse, which is that biostimulatory product. But we have now restored volume to the deficit side of her face and created overall harmony.
Got it. Well, it sounds like it was a great way to get her to have that what she had in mind to turn that into reality. So I'm curious, as far as do you get many people that have body dysmorphia where they view themselves a lot more critically than someone objectively would? I mean, does that happen? Like, do you get to see people like that on a not regular basis, but I mean, do you see people like that from every now and then?
Absolutely, I do. And I find once some people start getting injections, then it's almost like you criticize things even more.
Hmm.
But I do have patients, and I am not afraid to say no.
Hmm.
So I'm the injector that will absolutely say no. You do not need more volume in your cheeks. You do not need more filler in your lips. Sometimes I almost feel like I talk myself out of things more than I do into injectables, but I want my patients to look their best. And so if we have unrealistic expectations or, something that is going to, like I said, too much volume in the cheeks and things like that, I'm going to say no and keep it safe.
Well, I think that's a really important case that or point that you make there is that people actually trust you more when you tell them no. Uh, Even though it's like we know it's a business, we know like I mean, we have to make money because it's a business. But sometimes telling them no, you have to draw that line. And I mean, you are the professional, you are the injector. But even when we tell them no, it's like, okay, they believe even more. They really believe in your professionalism and your ability. Because sometimes it's unrealistic what they're looking for. So,
Yeah, absolutely. And then I say, there's always other things we can do, facials, microneedling, those kind of things, but I want to make sure that we keep with the best result.
got it. Now, Lauren, where do you think the future of aesthetics is going?
I think it's going to continue to grow in the regenerative space. All of these new products like exosomes and PDGF, which is platelet-derived growth factors, I think those products are going to continue to evolve and get better. And then I do think we're going to continue to move in that holistic space as well by addressing beauty from the inside out.
Awesome. Well, the future looks bright. So now, when it comes specifically to your practice, Salah Aesthetics, what's your vision for the practice?
We are currently in a time of growth. So I have recently brought on potentially an esthetician and a new injector. So we're definitely in a time of growth. And I'm excited to bring these ladies on and expand the team and be able to treat more women to the best that we can in Columbus.
Got it. Now, what would you say is the most important piece of advice you can give to someone who's thinking about getting some type of aesthetic treatment or holistic wellness or something done, but isn't sure which provider to choose?
Sure, absolutely. Go in for a consultation and meet the provider that you're thinking about um, working with. Ask them their credentials. So here in Georgia, you at least have to be an RN to do injectables. So ask them their credentials, ask them what trainings they've gone to recently. I am very big on continuing education. I go to a training, I think, every other month because things are constantly evolving in aesthetics. So ask them what trainings they've gone to recently. When was the last time they did a cadaver course? I do one of those once a year. But I think, and then asking to see some of their before and afters will be very helpful as well.
Okay, awesome. Well, Lauren, I have one last question for you, but before I ask it, I do want to point people to your website at salahaw.com. Now, last question is, what does beauty mean to you?
Beauty to me means confidence, where you feel confident in yourself. And that really stems, like we've talked about, from the inside out. So whatever that is, whether that be weight loss or, getting the tox because that one little wrinkle on your forehead bothered you, I believe that whatever you can do to make yourself more confident, then that is what beauty means.
Awesome. Well, there you have it, Lauren sharing her expertise. So, Lauren, where can people contact you and your practice?
Sure. So on Instagram, we are at Salah_clinic. Or of course the website, and then our office number is 706-810-5525.
Awesome. Well, Lauren, it's a pleasure. A lot of fun talking with you, bringing you on and you sharing your knowledge. Thank you again for being part of the show and sharing your message.
Thank you so much.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.